back to issues that are important in health and aren't on today's agenda at the World Health Assembly. Let's go to aging, something that we're all doing. In many countries, the proportion of people who are over the age of 60 is rising faster than any other group. Now, the population aging, I guess, can be seen as a positive thing. We're living longer, which means that we're doing better at public health. But there's certainly a lot of challenges that go along with that. I think getting older also has negative perceptions, doesn't it, John? And, people are getting older, you get less able to move around, less able to have freedom of lifestyle, and sometimes even neglect. Joining me now to talk about aging populations and how WHO is working to help countries adapt to these aging communities. John Beard, who is our Director of Work on Aging at WHO. John, thanks for joining us. Kind of sum it up for me here, if you would. Outline the issue that we see in this new trend of aging populations.
Okay, well, I think the best way to look at aging is from the positive, is to realise that older populations are an incredible social resource. Older people contribute in many, many ways, whether it's in their family, in their community, or in the workforce. But for us at WHO, one of the key issues is that all of that is only possible if people can retain their health. Mm-hmm. And so what we're trying to emphasise now and into the future is the things that individuals can do and the things that society can do to make sure that, as far as possible, we all experience healthy ageing.
And what are some of those things?
Okay, well, there are things which each of us can do, and they're the obvious ones. We should stay physically active, we should eat a good diet, we should build relationships and maintain them so that if things go wrong, we've got somebody we can turn to. But there's also things that society can do, and they operate in two directions. One is for healthy, energetic older people. We need to break down the barriers which currently exist to their participating and contributing. So in many places there are laws that mandate retirement. There are laws that prevent people participating in various organisations, whether they're overt or not, that limit their potential, for example, to go to university or other forms of education. So we need to break down those barriers, but we also need to create an environment that's much more supportive of older people. We also, very broadly, in many parts of society, we tend to have negative views on ageing. And they can become self-reinforcing when we impose them on the older person. So what we want is for society to change the way it views ageing, and also to start providing the services and the infrastructure that's necessary to help people to experience healthy ageing.
How do you change some of those attitudes? How do you help communities and society see the positives more than the negatives when it comes to aging?
That's a good question. Yeah. It's interesting, though, that when we look when you ask people, their attitudes to their relatives who are old are generally very positive, but their attitudes to older people outside are much more negative, much more stereotyped. So we think of older people as frail, needing a walking stick, needing some assistance. Whereas in fact, in many parts of the world, a lot of older people are very active, very energetic, and contributing in many, many ways. So I think the more people see those more active models, the more they might broaden their perspectives. But at the same time, we mustn't forget that there will be frail and more vulnerable older people who will need some support. So we need to think positive, but we also need to make sure that we encompass the whole experience of older age.
Now, if you have any questions for John, feel free to email them to us or send them to us on Twitter. That's hashtag WHA68, hashtag SocialGood. A moment ago, you were mentioning prevention, things that we can do to stay active longer as we age. You were talking about staying active, and you were also talking about social relationships and finding ways that you can stay active in the workforce longer. How important is that social connection? That's intriguing to me.
It's very important, and it's important in many ways. First of all, if we experience adversity, it gives us a channel to turn to somebody for some help. It gives us somebody to share our adversity with, or maybe they can provide some direct support. But what we've also found is that the more relationships you have, the more you remain engaged with other people, the better it is for your health. So it's a two-way street. That actually having the relationships is also beneficial for you in less direct ways. And it's interesting when you look at well-being. a lot of people think that older people aren't happy. But in fact, in many parts of the world, well-being is a U-curve. And so well-being is very high when you're young. In midlife, when you've got a lot of work, you've got the children to raise, you've got a lot of pressure in terms of career and other problems, well-being is actually at its lowest. But as you age and or as you get older, it rises again, so that you have a peak in early life and in late life, which is not what people expect.
That's not what you expect at all. You've got a big report coming out in a few months looking at aging. Can you tell me a little bit more about what that report is looking at and what we can expect?
Okay, well, we're particularly looking at health, so it's going to be on healthy aging. And we're trying to reframe the way people think about health, shifting it from the absence of disease to really thinking about functioning and what it is that older people can do and how we can enable that to happen. And you can do that in two ways. One is you can help the older person themselves build their strength. You can help them maintain their physical capacity, their cognitive capacity, all of those things which traditionally WHO would be associated with. But you can also, even for people when they have lost a certain degree of intrinsic capacity, there are ways that the environment can make it easier for them to continue to maintain their relationships and to maintain their involvement in society. And so one of the initiatives we have more broadly or outside the report is the Global Network of Age-Friendly Cities. We have over 250 cities at the moment, representing close to 100 million people, where all of those municipalities have committed to try and make those places a better place for people to grow old in. And they do all sorts of neat things. So they can range from making public transport more accessible, making public spaces more accessible, making places safer, better lighting, and enabling older people to participate and enabling them to have a say in the decisions that will affect them.
Now, my viewers will fire me if I don't ask you the obvious question, even though it's not the one that has come in. The question that I think everybody wants to know is, what are some of those cities? What are some of the cities that are on the front end of adapting for older populations?
Okay. I'll give you a couple at the extremes. The first city to join the global network was New York, and they do absolutely amazing things. And if people want to learn about it, they can go to the web and they can look up age-friendly New York, and they will see them. One of the things that they did was to involve businesses within New York to look at how they might be able to contribute, and how if you have a shop in New York City, how it might be more age-friendly. So they have a really neat program. But at the other extreme, one of the cities we work with is New Delhi, and in the slums of New Delhi, they have a program looking at how you can make a slum more age-friendly, which might seem impossible.
Yeah.
But they went and they asked older people in the slum, what is your biggest worry? What is the biggest problem for you? And then they said safety. I feel so unsafe. This is very common for older people, sure. and often though older people are more sensitive to risk than is actually there. Often it's not quite as bad as they see. But in New Delhi, what they did was they arranged for somebody to come into the home of the older person and take the mobile phone that's available in the home, because even in the slums everybody has a mobile phone. Enter in a telephone number and say, this is the number of your local policeman. I want you to call them. This is probably the first time this person's ever had any contact with a policeman in a good light. So they press the button, and at the other end the policeman had been primed and expected to receive the call, and he said, oh look, thank you very much for calling, Mrs. Singh. You know, I'm very pleased you've got the number. Now listen, if you've ever got any problems or you're worried about anything, you just call me again. Make sure you keep this number and I'll be there waiting for your call. I think it's fantastic. I mean, if that can happen in New Delhi, we can learn. And the other thing about the global network is it's about not just the North teaching the South what to do, but South, North, the whole lot. It's terrific.
Wonderful. John, I'm going to have to let you go, but I could talk to you a lot longer on this, something that affects everybody, aging. We'll keep an eye out for your report. When do you expect it to be out?
October the 1st.
October the 1st. There you go.
Christy.
Thank you for coming by, John.